I will start by checking for past and present history, and then I will also do an inspection for any swelling, discoloration, or deformity. And I will start with bony palpations, and I'll start with by palpating the shaft of the tibia and fibia, check for any fractures. Then I will palpate the lateral and medial malleoli for any fractures as well. And then I will palpate the dome and neck of the talus for any fractures again. Next will be soft tissue palpations, and I'll start on the medial side of the foot, and I will palpate the anterior portion of the deltoid ligament, then the mid portion of the deltoid ligament, and the posterior portion of the deltoid ligament. Next, I will palpate the anterior tibular fibular ligament to check for any sprains. And then next, for soft tissues, I will palpate the anterior, or the ATF, CF, and the PTF. And then finally, I will palpate the peroneal tendons, which run along here, and they go up to check for any tendonitis or subluxation. And then after soft tissue, we move on to special functional tests. And the first one's going to be special tests. The first special test we're going to do is the squeeze or referred pain test. And I'll do that doing this, check for any tibial or fibular fractures. And then I will then do the calcaneal bump test to check for any tibial or fibular fractures as well. And then next we have stress tests. So for inversion, we're going to start with plantar flexion inversion for the ATF. Then zero or neutral inversion for the CF. Then dorsiflexion and inversion for the PTF. And then for eversion, we're going to do plantar flexion eversion for the anterior deltoid ligament. Then we're going to do 0 degrees or neutral eversion for the mid deltoid ligament, and then dorsiflexion and eversion for the posterior deltoid ligament. And then next we'll move on to the anterior drawer test. So provide a strong base hand, cup the calcaneal, and then we're gonna pull. And then that's to test the ATF and the anterior deltoid ligaments. And then we're gonna do the posterior drawer test. And that's to test the PTF. And then next is a testing range of movement. I would test both active and passive range of movements. In this case, I'm gonna have her do active range of movement. So we're gonna start with dorsiflexion, 20 degrees, and then plantar flexion 50 degrees. And then we're gonna go with inversion 5 degrees. And then I'll have you do eversion 5 degrees. Perfect. Next is gonna be muscular strength test with restricted range of movement. So first I'll have you do plantar flexion. So I'm gonna start doing dorsiflexion, and then you're gonna go against me, remember? Okay, ready? Go. 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 And then that's testing the gastrocnemius and soleus, as well as the tibial nerves. Next, we're gonna test dorsiflexion. All right, ready? Go. 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 And then that's testing the tibialis anterior and the deep peroneal nerve. Then we're gonna go inversion. All right, you ready? I'm gonna start you with eversion. Go. 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 And that is testing the tibial nerve as well as the tibialis posterior. And then we're gonna test eversion. So I'll start you with inversion. Go. Go. goat. And then that's testing the peroneus, longus, and brevis, as well as the superficial peroneal nerves. And then next we have neurological tests. We're going to start with motor. And so for L4, I'm going to have you do dorsiflexion and inversion, and that's testing L4. To test L5, I'm going to have you do just toe extension, so pretty much dorsiflexion. And then to test S1, you can relax now, S1 and ankle eversion, so it's this way. And then to test S1 and S2 is just plantar flexion. Perfect. And next is going to be sensory. So for L4, that's the medial side of the foot. Then for L5, the dorsum, or the web between the toes. And then L5, S1 is going to be the lateral side of the foot. And then, can you feel that?
Yes.
Okay. Next is going to be the reflex, so roll over. And it's going to be the Achilles tendon reflex test for S1. All right, good. Roll back. And then next is going to be blood flow tests, and I'm going to start with the dorsopedal artery pulse test. That's right. There it is. And then next I will do a recapillarization test and squeeze the toes. The color should come back in less than 2 seconds. And then finally, I would compare bilaterally.